living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Are you overlooking your eye health? Your eyes are connected to several systems in your body and can give you valuable insight into your overall health. And your overall health can help or hurt your vision. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we take a good look at eye health. Stay tuned. Welcome back to Healthy Living for Life. Joining us first this morning is Matthew Nottingham, a doctor of optometry. And thanks so much for being here this morning.
Thanks for having me.
So can you just start out by telling us what happens, or what are some common issues that happen as we age, and why do those common issues happen because of age?
Sure. So probably the first thing that people start to notice just with age is the fact that they need reading glasses. So usually early 40s, we start to see some of that. And that's usually what we'll bring patients in because they have a hard time reading, notes or computer material or computer distance material. And then after that, we start to develop things like cataracts. And then with age, we have a higher risk for macular degeneration, glaucoma, those types of things.
So since these things happen as we get older, should we see an optometrist more often?
Yeah, so typically we recommend people have eye exams, once every year to every 2 years at the most. I tell most of my patients after the age of 50, I like to see them once a year, dilated exams once a year.
And why are those eye exams important?
Well, they're important, for eye health, and then obviously, if patients are wearing glasses or contacts, we have to update those, make sure they're seeing as well as they possibly can. But just watching out for certain diseases, changes in their medical history can cause, certain eye problems to develop. So as like many things, as we get older, some of those problems tend to happen. So we want to watch out for those. And
so eye exams can reveal some of those other health issues?
Oh, absolutely. Okay. So, if somebody has elevated blood pressure, cholesterol, diabetes, certain types of cancers, any cancers really, but a lot of systemic diseases, immune problems, those can sometimes be detected during your eye exam, or we need to monitor for problems associated with those systemic diseases.
Okay. So you mentioned people who wear glasses or contact lenses. Should they see an optometrist more often than someone who does not wear those corrective lenses?
Yeah, anybody that wears contacts, we want to watch them, their eye health, and just with the contacts themselves being a medical device, we want to watch them on a yearly basis. Patients that have glasses, if they're healthy eyes, they're fairly young individuals, exam every 1 to 2 years is fine, unless they're, fairly nearsighted. We have higher risk of retinal tears, retinal detachments with nearsighted eyes. So I typically tell my patients every year they need to come in for a dilated exam to try and find some of those asymptomatic type tears.
Okay. Yeah. So we talk a lot on this show about why it's so important to know your family history and your own health history and keep track of all of those things when you talk to your healthcare professionals. Is that similar to eye health, and what should people keep track of?
Yeah, if I have a new patient come in, it's important for me to discover certain things about their eyes, but it also helps if they already know some of their own eye health and can relay some of that information to me before we even get started. But it is important. It makes sense to know as much as you can about your own body.
We talk a lot too about the impact that smoking can have on your overall health. How does smoking affect your eyes?
Well, smoking is pretty bad for you in general. For eye health, smoking constricts your blood vessels, which, we need our blood vessels to deliver blood, oxygen, nutrients to the retina, certain parts of the retina and the optic nerve. So if we're constricting that blood flow, there's higher incidence of, say, like macular degeneration. I think it's a 3-fold increase in risk of macular degeneration if you're a smoker. So anybody who has family history of macular degeneration or already has signs of macular degeneration, it's a pretty big deal for them to quit smoking, because that's one of the things that you can actually have. You can quit yourself. and being a threefold increase, we would want to nip that in the bud if we could.
Yeah, that sounds serious. So what about sleep? Sleep is also one that is important to a lot of different elements of your health. How does it impact your vision?
Sleep, good sleep is needed, mainly from probably the corneal standpoint. Getting good sleep helps hydrate the cornea and get oxygen to the cornea. So those patients that wear contacts, that's a big deal because wearing a contact all day impedes the amount of oxygen flow to the cornea. So taking those contacts off at night, going to sleep, the blood vessels from the inside of the eyelid deliver oxygen to the cornea. So it's important there. Also just for dry eye patients, which in Montana we have quite a few of those, keeping the cornea moist. So good sleep is helpful for dry eye patients also. Okay, that makes sense. You talked a little bit about blood flow and the importance of that, and another thing that happens to a lot of folks as we get older is blood pressure. I mean, so how does blood pressure, if someone has blood pressure, should they be thinking about their eye health? Yes, blood pressure, elevated cholesterol, all of those kind of go hand in hand together. So, from an eye standpoint, we can see if somebody has elevated cholesterol looking at the cornea. There's certain signs that we can look for looking inside the eye at the retinal vessels. We can see if there's plaque buildup. So keeping in touch with your primary care provider, keeping your blood pressure low, keeping your cholesterol in check is really important. And we like to send feedback to patients' primary care providers if we're seeing issues like that with the retina. So I think anybody that has issues with cholesterol or elevated blood pressure should come in for an eye exam at least once a year. Okay. And we have time for maybe one more question. You talked about cataracts earlier. Why do cataracts happen? It's one of those fun aging processes. There's different theories on exactly why a cataract develops, but it's mainly because of oxidative issues and things like UV light affecting the lens. I tell most of my patients, you live long enough, you're going to get cataracts. At this point, that's the way that it is. But there are some things that you can do to decrease your oxidative stress in your lens, like wearing sunglasses, polarized sunglasses, not smoking, having a healthy diet. Okay, great tips. Yeah. Thank you. So we do need to pause here for a quick break. But if you have diabetes or pre-diabetes, you won't want to miss our next segment. Stay with us. We'll be right back after this short commercial break.